how to remove a central line dressing as well as the central line itself. So make sure that you have the doctor's orders first off, you have your mask for the patient as well as yourself, clean gloves because it isn't a sterile procedure except for the site of course, so make sure your 4x4 gauze, a tegaderm or a pressure dressing, okay? So you perform hand hygiene, tell the patient what they're doing, place them in supine position, don your clean gloves, and have the patient turn to the opposite end. There you are. And remove your old dressing, noting where the catheter is inserted at that point because you're going to document this later. And then you slowly take out the catheter, like so. Make sure that they take a deep breath while you're doing it. And there you go, they can release. You're going to document the there you go. But put your dressing on top of it, pressure for about 5 to 10 minutes for a patient that's not on any anticoagulants, 10 to 15 for those who are, until it stops bleeding. And you grab your occlusive dressing and place it on top of the pressure dressing. And sometimes this happens, and just make sure that you straighten everything out so that there is enough pressure and the puncture site is covered fully. Some people like to put some biopatch at the bottom to help prevent any microbes from growing. And then you date, you time, your initials, and how you're going to document on how the patient tolerated it, apply more pressure if you need to, and then that's it. You're going to also take your catheter and you assess at the end to make sure that there's no breakage at the tip of the catheter, and then you're going to document how well the patient tolerated it and how easy it was to